In babies under 2 months, it's not uncommon to see certain conditions that remind us of their fragility, how they're still developing. Even if babies arrive with all 10 fingers and toes perfectly intact, their organs are still going through growth spurts in the weeks and months to come. For new parents, when you hear your child crying, that intense cry, it really does tug at your heartstrings. And even when you give them all the love in the world, all the hugs you can muster, you still may not be able to console them. Sometimes parents feel they're incompetent, that they're not able to comfort their baby, and then can feel a sense of terrible distress. However, crying often has nothing to do with all the wonderful care you give. After all, baby has to express themselves, and they do it by crying. So, today for this presentation, I will talk about babies under 2 months of age, perhaps more specifically around 4 to 6 weeks, that I see with parents in my office. The 6 newborn ailments or discomforts that we see most often. I will name them for you, and then I will explain each one separately. I'll also give you little tricks and advice on how to handle specific conditions. For those of you who have not yet given birth, you'll already have this information. You'll recognize what's not serious, but merely a short-term, discomforting growth spurt for your baby. For those who have their babies and are experiencing some of these ailments, you'll have tips to help you at home. So let's take a look together at newborn conjunctivitis, seborrhea dermatitis, commonly called cradle cap, bloating, when the tummy appears swollen, regurgitation and vomiting. Often we confuse the two. Baby reflux, and colic, what we can call real colic. With newborn conjunctivitis, we should start by saying that more than half of newborns will have an eye infection of sorts. Why? There are glands in the corner of the eye, near the nose, in what we call the internal canthus of the eye. This tiny gland can be blocked for a newborn.